So it means you need to be on top of your data, where it's coming from. You need to understand what patients want. We live in the Uber economy, which means that, if I want to go somewhere, I pull up my smartphone, I can get a ride. Or if I want food delivered, I can get whatever, DoorDash or something like that. That's going to come for healthcare. Healthcare takes a while because of the regulatory burden and the fact that we're 100 years behind every other industry, it seems like. But it is something that is coming. It's what patients want. It's what they demand.
Hello, 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 everyone, and welcome back to Scaling Practice Management, the show where we help you grow your medical practice smarter, not harder. Brought to you by Talkie AI. We are the AI voice agent for the medical front desk team. My name is Jakub. I'm the host of the show. Super pleased to have you here, watchers and listeners, and I am stoked to have my guest here today, Rafael Salazar, principal at RehabU Practice Solutions and host of the Better Outcomes Show podcast. Rafi, how are you doing today?
Doing all right. Excited to be here.
I am super excited to interview you too. Previously, our COO, Ada Andruszkiewicz, was on your show as well. You can check that out. That's Better Outcomes 148, I believe.
I believe so, yeah.
Yeah. So check that out. We'll put it in the show notes, obviously. And now I get to interview you, which is honestly going to be a treat.
The tables have turned.
Exactly. Do you often also guest on shows, or is it mostly just hosting?
I do a lot more of the interviewing than being interviewed. But yeah, I've done my little rounds with shows here, there, and everywhere.
Yeah, exactly. Yeah, that's good. I love to interview, but being a guest, honestly, is also quite fun.
Yeah.
So let's launch into it.
Sure.
Before we talk about the topic of the episode, and we were planning to make this pretty freeform, so we'll see where the conversation takes us. And before we talk about your businesses, I wanted to ask you a little bit of an icebreaker question. So Rafi,
Sure.
Here it is. And we haven't rehearsed this before, so let's see what the answer is. What is the most fun thing you've done this year thus far? I mean, we're recording this in March, so I can also accept the 2024 answer if you have one.
Oh, most fun thing I've done this year. So let's see here. Probably the beginning of this year. So I live in the South in Augusta, Georgia. I think the last time it snowed in the area was like 5 or 6 years ago. My oldest is 10 now, and I think it must have been 8 or 9 years ago because he was just 1. So this year we had an actual legitimate snow where there was powdery snow. And I took the whole day off of work. I mean, the city shut down because of snow. So I spent the whole day out in the yard with the kids, playing in the snow, getting super wet and cold, and then warming up by the fire, and then going and doing it all over again. So.
That's so nice. Yeah, we here in Poland, we get snow a little bit more often, although the quality of it really differs. We had 4 to 5 days, not in a row, but overall throughout this winter, of really solid, really good snow. We have a hill right in front of our block of flats here. So got a sled, went down the hill a few times, but then my son, who is 3, started having ideas. So he's like,
Yeah.
Dad, why don't you get on the sled? And I'm like, okay. So he pushed me down, and then I hear him laughing behind me, but the laughter isn't getting quieter, Turns out he had
jumped on?
these slippery pants. No, he was sliding on his pants behind
Oh,
me.
nice.
And he just wanted to keep doing it over and over again. And I thought, okay, the people around us must think we're kind of mental,
Yeah.
like we're on the sled and he's behind. But anyway, that's awesome. Snow fun is really great. Leave us a comment, watchers and listeners. What is your favorite winter activity? Sorry, got a drive engagement. So that's great. Speaking of the watchers and listeners, I wanted to begin by asking you what is supposed to be the traditional scaling practice management question, although this is one of our first recordings actually for the show. So, Rafi, and I'm really curious about your answer here, but I wanted to ask you, what is your number one tip for successfully scaling a medical practice? That's what the show is about, after all.
Yeah, I mean, this is in my mind, a fairly easy one to answer. It has to do with, obviously, my show is the Better Outcomes Show. I'm all about humanizing healthcare. I think one of the biggest mistakes, even that people make when they're trying to grow a healthcare practice, is they've got the systems, they want to implement the systems, the technology, whatever the process of care is to deliver, care at volume or care at scale, and they spend a lot of time focusing on the processes and the systems and the scaling itself, and less time worry about like the people that are delivering the care. So in my mind, the number one tip is really to focus on the people that are delivering the care in your clinic or your practice, and also the people receiving care. And that means that you're going to spend a lot of time, if you do that, focusing on kind of those soft skills, but the building the culture, putting the right team in place. That whole idea of like getting the right people on the bus and then figuring out where they go later, but really focusing on the culture and the team you're building, because that team is going to be the foundation for any kind of scaling that you end up doing or deciding, to engage in this area or expand into this, process or service or whatever. It all starts with the team. So focusing on the team would be the number one tip.
I love that. I love that. And I think a lot of people in leadership roles in general, not just running medical practices, but I'm head of marketing at Talkie AI. I have my own team. This is on my mind too, right? Taking good care of my people. So I wanted to ask you, within this realm of taking care of your people, what have you seen as some tactics, strategies, tools, frameworks that have worked for you?
Yeah, I think the biggest thing to keep in mind, and I read this in a book one time, it's called Managing Right for the First Time by David C. Baker.
Hmm.
But he talks about in anything, healthcare included, people are often elevated or promoted because of technical expertise. Like I'm a good clinician, so I become a clinical director. I'm a good, whatever, and I get promoted up the chain. And that in and of itself is not a bad thing, but it means that as organizations, typically, we're not promoting people based off of the skill or the ability of people management. We're promoting based off of the technical expertise, because we think it translates. If you're a good physical therapist, you'll be good at managing physical therapists, and it is a totally different skill set. So one of the big strategies that I like to employ with clients that I do at the clinic that I own and operate is like, if we identified somebody that's going to be a maybe a potential long-term leader in the organization, we start very early on supplementing their professional development with those soft skills, those leadership skills. So it might be that you're sending them to courses about leadership development. It might be that you're just having conversations with them about it. It might be that you're having them read books about leadership and what it means to actually lead people and not be a technical expert. Because a lot of times, as you get higher in an organization, um, you might have been a technical expert at one point, but at this point, when you're leading, your role is no longer doing, it's really empowering your team to deliver the care, in this case, in healthcare, or to be those technical experts. And your job stops being, delivering and starts being enabling or empowering. So that's probably the biggest tip or strategy, is like start that from the beginning with people in your organization that you're looking at potentially elevating into management or leadership positions, for sure.
Yeah, I really feel that. And I feel, I almost feel like having what you're saying is you're calling this technical expertise, right? I almost feel like having strong technical expertise for some leaders who are inexperienced can be almost a detriment,
Yeah,
because the temptation to just take matters into your own hands and not properly delegate to your team, it's so much stronger when you know that I could do this myself so much faster, so much better. But that
exactly.
doesn't,
Yeah.
yeah, that doesn't scale and doesn't grow people, right? So I do really feel that you need to take that into account. The way I've always found this works and heard about stories as well is, before somebody becomes a leader formally, like a team manager, there's opportunities for informal leadership as well. Lead a project, lead an initiative, be somebody's mentor, give somebody feedback. I don't know if you found this to be useful as well, but I feel like in terms of making it more gradual, that's one of the things that I found works.
Yeah, and in in reality, if you think about it, like at some point in time, if you've identified somebody that's a potential leader, by the time you end up promoting them or making them a manager, it should be one of those things, or should feel like one of those things, like we're just officially putting a title onto what's already happening, right? Like this person has stepped up on their team. They are the people that their team members go to ask for advice or for guidance. And we're really just making it official by putting them in charge, right? They've been leading for a while, and now we're just making it official on the org chart. But in reality, they've been, like you said, that informal leader. People are coming to them anyways. They're kind of taking more of that leadership or mentorship role kind of just naturally, right?
Yeah, so I'm curious about one thing, and this is purely out of my own curiosity, right? I'm in the realm of marketing and, in terms of giving feedback, it's all very digital, right? I get a
Yeah.
text that I review, I see some video that I review, but we're talking about, actual work with patients. This could be, I don't know, something like physiotherapy, right? So I'm just curious, what are the feedback mechanisms there? Because you, does it, and honestly, I'm admitting to my own ignorance here in the sense of I don't know how it's usually done, if it's very different to the digital space. So I just thought I would ask about that.
Yeah, I mean, I think so you are kind of reviewing folks like based off of, the documents that they're signing, the clinical documentations, their clinical outcomes even. But there are ways that you can get like maybe in your case, you're dealing with somebody that's a marketing specialist or an account manager, like you're reaching out to their clients and who they're having interactions with and seeing, give us some feedback on how, Jim is doing in his interactions with you. We can do the same thing in healthcare. There's actually a survey out there. It's called the CARES measure, CARES, and it stands for Care and Accountability and Relational Empathy Scale. And basically, it's like a series of 10 questions. You can have patients fill this out at the maybe their first interaction with a clinician and then their last interaction with a clinician. But it basically asks the patient, like, did you feel heard, valued, listened to, understood by this clinician? And most of the organizations that I've worked with that are like doing really, really well on creating a good culture that patients love being at, that team members love staying at, are doing something along the lines of employing something like a care survey or care measure so that they're getting real time feedback from the actual people delivering the service in a way that they can break it down and be like, okay, all of Rafi's patients really say that he's good in this area, but this area is a place where he can improve on or something. And then you can go to the team member and say, listen, this is not just me like subjectively pulling this out. This is what your patients are telling us. Um, are your areas of expertise or your areas that you're really, going well in. And these are some areas where there's some room for improvement. So what can we do to kind of improve that or work on that or build that up a little bit? But it gives you some real tangible and specific examples or skill sets that you can say, this is what you're doing great at. This is what we can improve on.
I love that. I love that. Really useful, really actionable, something that the watchers and listeners can take away. So thank you for that. I am curious about more things here, but we'll put a pin in that for now because there's a couple other things I wanted to
Yeah.
cover within the time that we have. But first, a brief intermission. We launched right into it with the number one tip question, but let's now take a small break and give the listeners a little bit more context about you. So can you tell the listeners about RehabU Practice Solutions, about the Better Outcomes show so that people know a little bit more about what you've been doing?
Sure. Yeah. So I've been I always tell people I've been at RehabU. I started RehabU Practice Solutions back in 2017. And at the time, I was a clinician myself working for the Department of Veterans Affairs in a big veterans or VA hospital here in the US. And at the time, I was taking a step away from that because I had done some leadership development, some senior executive training and management, and got really recruited to go be part of a management consulting firm that was helping the state of Georgia with their Department of Behavioral Health and Developmental Disabilities on a pretty large, pretty significant project. And I was told at the time, listen, this is a great and meaningful job. It'll be an awesome project, but it's only going to last 6 or 8 months. So I knew in the back of my mind at the time I had one child and one on the way. I was like, I'm going to need something long term. I can't just do one consulting contract. As my wife likes to joke, consultants are always there's somebody always in between jobs, right? So I started Rehab U kind of on the side. And the idea was it was really because of my academic background, was really going to be like an education company, Rehab U, right? For clinicians that were delivering care in the clinic. And then one thing led to another. And I ended up getting really involved in a lot of virtual service delivery methodologies, standard operating procedures, leadership development. And it kind of morphed from this, I'm going to build courses online that I can sell clinicians to really, I was going to practices and clinics, either virtually or in person, to deliver or to do strategic planning engagements, to work on consulting projects, So it kind of morphed from like an education company into a consulting firm, and that's kind of what I've been doing for the last, yeah, at this point, 8 years, working with healthcare organizations and healthcare technology companies for everything from go-to-market and positioning strategy to clinical operations, digital transformations, you name it. And because of the point that, consultants are always, looking for work, we're always in between jobs. I needed a way to kind of generate some business for the consulting firm. And somebody, this is 2020 now, everybody was at home because of the pandemic, and somebody said, well, why don't you just start a podcast, because it's a great way to get content out there, and it's also a good way to connect with people in the industry. And I started the Better Outcomes show about that time, and really the idea was, in my mind, like, it was a um totally selfish project. It allowed me to have conversations with people who would not otherwise give me time to have conversations. So I just reached out to a bunch of people that I thought were doing cool things in the healthcare space, and just having a conversation, right? So, like, early on, my early guests were one of the first people to do like direct primary care here in the US. We had a couple technology companies, a couple clinicians that were involved in like cutting edge clinical research, and that's kind of the way the show has been over the last 149, 150 episodes, is really just cool people that are smart people doing interesting things in healthcare. And then we the underlying current that we try to tie it back to is, how do we use this information, or how does this work help the healthcare industry as a whole become more human focused, whether that be the people, the humans delivering the care, or the end recipients of healthcare, the patients themselves. And yeah, I've been doing that for the last 8 years. In addition to that, I also own a physical therapy practice here in Augusta, Georgia, since about 2020 as well. So kind of got my hands in a few different things.
Yeah, yeah, I can totally see that. And I am curious about the podcast itself, Better Outcomes. I have a couple questions
Sure.
about that. So let's get into that. First of all, you mentioned why you started the podcast, to selfishly generate business and open up conversations. I can certainly relate to that, because that's one of the beautiful things about running a podcast. But you have got 150 episodes out now. So obviously it must have worked out for you in a pretty big way. Would you say, is that the same reason you're continuing the podcast, or like what's keeping you going with it?
Yeah, I mean, at this point, it's kind of on, I hate to say autopilot, but we have people reaching out to us a lot to be on the show, and luckily my assistant does a great job of screening and kind of looking for the criteria. But it's one of those things that I love, having conversations with people that are doing interesting things. So if it's something that is a cool idea, I'm going to have a conversation. And I've got just time blocked out in my calendar, like on, this day at this time, Rafi's exploring this topic with whoever it is. And sometimes they get turned into podcast episodes, sometimes they don't. We just kind of take it one day at a time. But yeah, it's really, at this point, what's keeping me going is the fact that, because you're not, at least I'm not locked into like any specific thing. I'm just kind of, innovation in healthcare is kind of one of those ever changing things. There's usually something, like some shiny object that's attracting my attention. It's like, oh, I want to dig into that topic a little bit, or I want to dig into this kind of business model a little bit. Let's find somebody that's involved in that and get them on the show.
Yeah, yeah, that's really interesting. So as I was thinking about this, you've had 150 conversations, right? As of the time of this recording. This is going to be a difficult question, and like,
Yeah.
forgive me. But out of this 150, what was the one that was the most memorable, the most impactful? Probably not the one, but something that comes to your mind as, a conversation that really made a big impact with you.
Yeah. A couple of them come to mind. I can't remember the actual numbers of the shows, but I had Paul Singh on the show a while back, and he's the CEO of Strata PT, which is a big EHR, electronic health record, for in the physiotherapy space.
Mm-hmm.
And we had a conversation that I thought was going to be about, starting an EHR and kind of the ins and outs of building the software and what you do. And it really launched into, he's a first generation American, I'm a first generation American. So we kind of started with this and launched into this whole idea about entrepreneurship and what it means to lead people, and what it means to kind of build a business in a way that is offering real and tangible value to the world as a whole. kind of addressing some of those limiting beliefs that people in entrepreneurship, practice owners, business owners have. And it was one of those, like, I went into the conversation thinking it was going to be about X, and we went totally into a different area. But it was such good content. It was great. There's things that I say now to clients and stuff that are directly from that conversation. I'm like, oh, I once heard
Yeah.
this guy say X, Y, Z. So that was a good one. And then maybe 6 or 7 months ago, I had Dr. Ron Razmi on the show. He's a principal over at Zoe Capital, and they're a VC firm that's 100% focused on digital healthcare. And he wrote a book called AI Doctor, which was all about, obviously, as the title suggests, artificial intelligence being used in the clinical space. And that one was a really, really interesting conversation because instead of talking specifically about AI and, kind of everybody's talking about tech in healthcare, his viewpoint was really, and we talked about this a good bit on the show, was like this idea of technology in healthcare really only succeeds when it takes into account the business model in the context of the clients that it's going to operate in. A lot of times you get, engineers or tech smart people that create a tool that has a lot of capabilities, and that is quote unquote a good tool, and it probably is a really good tool. But the piece that they're missing is, like, how does this fit into the clinical workflows of the organization? How does this fit into the business model? Like, what is the ROI, not just generally, but like specific dollars and cents? And it really reframed a lot of my thought process with my own clients about, like, okay, you've developed this tool, this software, this product, this platform. Let's spend some real time thinking about not just um, the marketing piece of making it sound like it's going to deliver value, but like, how do you practically deliver value for your clients? And that was a relatively recent show that really kind of opened up my eyes a little bit to that in a really tangible way. So, and his book was great too. It's called AI Doctor. And I think the first chapter of that book, he's an ex McKinsey alum, so he was into the management consulting space, and he's also a physician. And the book is like, I love these kind of books. It's probably, I don't know, a couple hundred pages, and there's 50 pages of like references for each, like at
Oh.
the end. So it's like study after study. The first chapter is all about artificial intelligence, and if you really want to understand what AI is, that chapter breaks it down in very, very practical terms. Because I think a lot of times we think like, oh, artificial intelligence, but we really don't know what that means as far as how it's built, how it's working, what those models actually are. So it was pretty eye opening in that regard too.
So that AI doctor episode, I am 80% sure it's episode 128 of your show.
Yeah,
And
something
I
like that.
and I know that because Ada listens to it as she was preparing to come on your show, and she said that one was particularly, like, she recommended everybody listen to it on our Talkie Slack. So I can only second that. I listened to a part of that conversation as well, and it was great. And you're touching upon something that really is relatable from our point of view here at Talkie. So as I mentioned, we have this AI voice agent, right? It can pick up the phone in place of the medical front desk and also make outbound calls, right? And the vision I had in my mind as I was joining the company, which is still fairly recently, is that wow, it can really not so much replace, but it can, yeah, to some extent, it's like, okay, so it can do, like, it's a valuable point that it can do this work end to end. Pick up the phone, take the information, put it in the EHR. The medical front desk staff doesn't have to do anything. And in some cases, that is that, and that is useful. But really, uh, it's really apparent that the medical front desk really cares about also the human touch, right? The human interaction and the empathy. So what we found is that some of our users, they care about this being the first line of defense, Talkie being the app that picks up the phone. Then it lands in the EHR. You've got the transcription of the conversation, but then they call back. They don't actually lean on the technology to do all of the work,
Yeah.
just to make the work easier for the people who are already there. So they can, if there's a question they don't have the answer to right away, they can get the answer and then call back. Or if something is more urgent, they can call back earlier. So this really resonates, is that, you know, and again, I'm in marketing, right? So I know how to market Talkie. I thought I did. But after having these conversations, it turns out that removing some of the burden is important, but also keeping the human element is just as important. And that's why it's really important to take into account, like you said, the particular workflows in the business.
Yeah, I'm a big proponent of telling people like technology is great. It's going to transform the way that we deliver, provide, manage healthcare. But we really need to be thinking about it in the way of technology should do more to enhance the human experience of healthcare and less act as like a barrier, right? Because if you're implementing technology, like I think we talked about this with Anna on on our conversation. Like the last thing you want is like a phone tree, like push one to talk to this, push two to talk to that. Like you're just creating a barrier. But if you get like a personalized conversation, and then somebody real reaches out to you and says, "Hey, I know you called the clinic about XYZ." It's doing two things. One, it's getting the patient the information they need right then and there, but then there's that human touch where it's like, okay, these people actually care about me. They took time to listen to the transcription or the voicemail or whatever it was, and now they're reaching out specifically just to make sure I'm okay or whatever it is. Like that's really what you want. Technology should enhance the relationships that are already there, and not throw up walls or barriers to them.
Exactly, exactly. So I'm really glad I asked. That was a great segment there, your favorite conversations from the show. And I do really recommend the Better Outcomes show to you watchers and listeners. We'll put a link in the show notes, of course, but you can look it up as well. Good website and all that. So, and again, as somebody who's really plugged into the healthcare space, I thought what I would ask you next is to talk a little bit about the trends in the space, but in bit of a different way than usual, because I feel like, with trends in any space, right? There's the stuff that's top of mind that everybody's talking about, and then the other stuff that's kind of flying under the radar and people are kind of sleeping on, so to speak, right? So for example, everybody's talking about AI and the uses of AI, and
Yeah.
there's a lot of both signal and noise about that, if we're honest, right? But I'm curious from your perspective, because you're having conversations and you're getting deep into this subject, what would be some of the lesser known trends in healthcare right now? The stuff that's coming up, the stuff that you think is going to be much more prominent in the coming years, but is not being talked about right now?
Yeah, I think one of the biggest ones has to do with the data that all this technology is giving us. A lot of times, and this is, there are companies that have raised billions and billions of dollars in, Series A, Series B rounds on the premise of data analytics for healthcare. And that's great and that's good. But it's really large institutional data that those companies are managing, right? Big research hospitals, big health systems. There's a lot of opportunity I can't remember the exact percentage off the top of my head, but in like physiotherapy in the United States, something like almost two-thirds of the physiotherapy clinics in the United States are small privately held clinics. So that's a huge swath of data that's not being accounted for. Maybe we're getting it here and there and it's siloed. So in my opinion, if I'm looking at what's really going to be game changing over the next 5 to 10 years, is going to be some kind of tool or some kind of platform or some way to leverage technology that integrates all of that data from all these disparate little places into one unified area, one unified dashboard or something like that. One that's able to integrate with all the other EHRs and stuff like that would be wonderful. And kind of in that same piece is like, in all of these private clinics, in the healthcare tech space, especially in the United States, we've got all these solutions popping up, especially in the clinic. Some on the data management or like the practice management side, but specifically like clinical tools, for assessment or for treatment or something like that. They're all popping up and they're all getting deployed, which is great. The problem is a lot of them, mostly all of them, are point solutions. So it's like all of your data for, let's call it, maybe it's hand therapy or maybe it's, cancer therapy or whatever it is all being housed for this one piece of software, right? It's very much a point solution. And kind of to the point about data and integration into the larger picture, point solutions are only so valuable um, to large organizations in the fact that they're able to deliver currently the fact that they're able to deliver that specific treatment or specific service to a specific population, but you need a way to kind of back that out to kind of get a big picture of it. So again, kind of like my view here and what I'm looking for is like something that's going to be the hub, if you would, like a digital hub for a hospital system that brings together all of the data points from those point solutions into one interface, right? That would be really ideal. And I think even the companies, a few of the VC firms that I've had conversations with over the last couple of months are really looking for that. They understand that point solutions are out there right now in the marketplace kind of by necessity because there is no integration yet. But down the line, the companies that are going to be getting large investments and really get some institutional money behind them are going to be organizations that either tap into a digital hub of some kind or the one that creates it.
That's really interesting. So, one thing that I wanted to fill in to kind of build a picture in my mind, I'm wondering, so for example, in the realm of physiotherapy, what kind of data is there actually? What kind of data points are we talking about here, and how is it collected currently?
Yeah, so you've got everything from like clinical outcome measures that are taken at every, evaluative note. So they're, a lot of standardized measures. So for shoulders, for example, you could use a quick dash or something, which is a disabilities of the hand, disability assessment of the hand, shoulder, and hand or whatever. And that's like 11 questions. It's all standardized. You get benchmarks and all of that. So there's something like that for almost every diagnosis out there, different clinical outcomes that are being taken at various points throughout the care cycle. So that's one chunk of data is all the outcome measures, clinical outcome measures. Then you've got stuff like the amount of actual completed visits, billable metrics, uh, the actual units themselves, the codes that are being billed, the patient sat. Like I said, we use the care survey, stuff like that. So you have all of these pieces of data that are being collected, usually in the EHR of that practice. There are some companies like Photo is one that FOTO. There's like an outcomes management, data management for practices that kind of tries to integrate it all and gives you a report. But for the most part, these pieces of data are being stored really just kind of as raw data in a lot of the EHRs, and they're not being utilized because it's just sitting there. And we have to pull the quick dash for every patient that's ever been to our clinic or whatever. So that's kind of how it's being housed now. And there are, like I said, some companies like Photo that kind of pull some of that and aggregate it for the clinics, and you can kind of get granular, the quick dash scores for Rafi versus, Sarah versus, clinic A, B, and C. And there's some tools like that that are out there that are starting to really be used by a lot of clinics across the country.
So, I'm wondering if that is what you're saying, that this trend of centralizing the data is what I would label it as. I wonder, for somebody running a medical practice, what do you think they can do now or soon to prepare for this upcoming trend?
Yeah, so a lot of it would be understanding what key pieces of data or metrics you're wanting to track. So maybe it might be a specific clinical outcome. It might be a specific like length of care is probably a good place to start. Like how long is a patient typically involved with us for a course of care? So pick those things that you want to track, and it should probably be like one metric about like clinical operations and efficiency, one metric about patient satisfaction engagement, and one patient about clinical or one piece of data about clinical outcomes. Find out where you're currently tracking that or how that's currently being tracked or logged in your system. And then be on the lookout for tools that are going to come up that will help you integrate that or aggregate it all. So it might be for the first, there's nothing out there about managing this particular metric. So we have to create a dashboard that's, old school Excel or something like that, right? But there are getting tools that are coming to the market that you can input the data in and it aggregates it for you. So I would say the first step would be understanding those three areas, like I mentioned: clinical efficiency or operations, patient engagement, and then actual clinical delivery or outcomes. The pieces of data or the benchmarks that you want to track, where that data resides currently in your system, and then start looking for tools that help you integrate, aggregate, kind of visualize all of that data so you can begin making decisions.
Okay, yeah, that sounds really interesting. I do wonder, I mean, not to, I just mentioned that AI is an overdone trend, right?
Yeah.
But it begs the question, right? Whether once you have that data, something like ChatGPT or Claude could take it,
Yeah.
or something probably much more secure than that, could take it and then draw conclusions from it. That's much easier now than it used to
Oh,
be just a few years
absolutely. Yeah.
ago. So that's, I feel like we discussed that one to some extent. I'm curious if there's a number two trend that you would say. I mean, not to rank them or anything. We've done enough ranking. But anything else that you think is coming up that medical practice managers should brace for?
Yeah, I think and this is not like super hot take or anything like that, but there's the wearable sector, like the, Garmin watches, all of that data is right now being tracked and stored by these large companies. And at some point, there like the confluence of medical devices and data and like consumer wearables and stuff like that has all really taken place, and we've got data that's like on Apple Health or Google Fit or whatever it is that clinicians have or should be thinking about trying to get access to help their patients, right? And really, what it means is that we're moving more towards this idea of hybrid care models, where instead of maybe coming into the clinic all the time, you're delivering the right care to the right patient at the right time, which will involve trying to integrate with some of these consumer level technology pieces or platforms is as a way to supplement the data that clinicians are already getting. Which means that as clinicians and as healthcare organizations really moving away from this fee for service model where if you're not drilling, you're not billing type thing, really is going to become more of an important piece. Value based care has been one of those things that they've been talking about, since 15 years ago when I was in grad school. Value based care is coming. Really, technology is allowing us to think outside of the box in the way that care is delivered, in a way that is really, yeah, I hate to say revolutionizing because that sounds super cliche, but it really is making us rethink what it means to deliver healthcare services. And by extension, it means, our current billing model, the way we pay for healthcare right now is not fitting into that or doesn't fit into that framework. So it means that we're gonna start seeing and start moving into more value-based, reimbursement models with all the various payers and stakeholders. So it means you need to be on top of your data, where it's coming from. You need to understand kind of the what patients want. We live in the Uber economy, which means that, if I wanna go somewhere, pull up my smartphone, I can get a ride, or if I want food delivered, I can get whatever, DoorDash or something like that. That's gonna come for healthcare. Healthcare takes a while because of the regulatory burden and the fact that we're 100 years behind every other industry, it seems like. But it is something that is coming. It's what patients want, it's what they demand. So really that's probably the underlying current is like, listen, we need to start positioning our practices and our organizations to thrive in this kind of consumer driven economy, which means the way we pay for services, the way we track outcomes, the way we deliver services through like a hybrid care model really needs to become something that we might not be paranoid about, but that we're always thinking about. How is this going to affect the business? How is this going to affect the way that we're currently, delivering X, or the way that our operations currently are standing, in line of this context of like we're moving towards, you know, the DoorDash of healthcare, right?
That's really interesting. That's a catchy way to put it too. And you know what's blowing my mind is, as I mentioned, this is one of the the very first episodes of the show that we're recording right now. And already I had a conversation about using the data from wearable technology.
Yeah.
Like that's a testament to me, to the extent of the size of the opportunity there, because and it makes sense to me even as somebody who hasn't been in this space for a very long time, where let's say you want to take care of your cardiological, your heart health, right? You can visit a doctor and get an EKG every once in a while, but if you're wearing a device on your wrist, I have one of those with me right now, just not
Yeah.
wearing it so as not to get distracted. Like if you're wearing a device day in and day out that can also give you some of that data, that can be super useful to your cardiologist to also to have a much more informed opinion rather than just one data point from one day, right?
Yeah, exactly.
Yeah, I feel that. Okay, so that's that was very insightful and illuminating. So thank you for sharing that. I'm mindful of the time, and it's such a shame because I feel like I could talk with you about 15 other different
Yeah.
subjects. I'm gonna throw just one last one at you. I'm gonna be really mean because it's something that you do for a living, and I'm gonna
Okay.
ask you to encapsulate it in like 5 minutes, okay?
Sure.
But one thing that you mentioned that you do as you're consulting is like positioning for medical practices, right?
Yeah.
And I've got you as an expert here. I feel like it would be a disservice to the audience if I didn't ask at least a little bit about that, right? What's the kind of your best advice for taking care of positioning, or the biggest mistakes, or anything that you reasonably share in the few minutes that we have left?
Sure, yeah. So ultimately, like positioning, what I tell folks is like positioning is just identifying what you do, your specialization in your target market, right? Like we do X for Y. So maybe it's we deliver physical therapy for, post-surgical knee replacement patients or something like that. Um, the complicating factor in healthcare is that it's not just you and the patient, right? There's four different stakeholders in healthcare. We call them the four Ps, right? You've got the patient, the provider, the policymaker, and the payer. So, depending on who you are communicating with, each one of those stakeholders views or values something different in the care relationship. So when you're considering positioning your offering or creating your value proposition for your market, you really need to take into account like who ultimately is the economic buyer of my service, and how am I communicating the value that my service provides to that economic buyer. Because for example, if your patient has private insurance company or Medicare or something like that, the economic buyer for that decision, oftentimes, the patient is the end recipient, but they're not bearing the financial cost a lot of times. They're maybe 20%, maybe 15%. The real the real person who's paying the bulk of that cost is the payer. So you need to find a way to communicate the value you're creating to that payer in a way that that payer is going to say, okay, we're gonna pay for it. The same thing if you're developing a piece of technology or a piece of software, like there's end users and there's economic buyers, and you want to be able to one clearly understand who the economic buyer is, what they consider valuable in that healthcare exchange, and then how you fit into that piece, right? And that's really when you're talking about healthcare positioning, that's what it is. You're identifying that economic buyer, how your value proposition solves a need for them, and then also doing at the same time making sure you're not alienating maybe the end user or the person on the receiving end of your tool, your software, your device. So it's a nuanced thing that requires kind of looking at those four Ps and kind of how you're offering your product or service, your healthcare service or treatment kind of fits into all of those, and how you would communicate the value that each one of those stakeholders is desiring from you as an organization.
Okay, so I'm hearing that you might want to pay more attention to communicating your value, particularly to the payer in the equation. So that begs the question in my mind, what do the payers care about? What do they see as valuable that you should be communicating to them?
Yeah, it's going to depend on kind of what specifically your service is or your treatment is. Ultimately, though, like payers are worried about clinical effectiveness, I mean, it is about money and margin. So they're looking at decreasing the cost or the outlay of their spend in healthcare, but they're also looking at not sacrificing the quality of care or the clinical outcomes. So it doesn't do, Blue Cross Blue Shield any good to save $100 million. If, on physical therapy, for example, if it means they're going to spend $200 million on orthopedic surgery because they're limiting the amount they're paying for physical therapy, right?
I
So
see.
it's for buyer for the payers in particular, those are the kind of what you're looking at. You're like the quality of care, the clinical outcomes, and then the cost to the system, and making sure that it's a positive ROI for the payer.
Okay, I love that, and I think this is very good advertisement for the content that I've seen from you out there. I know you talk a lot more about that on your own channels. So, watchers and listeners, if you liked this as a taste of what Rafi can talk about, you can get in touch directly, or you can listen to his show because our time is slowly coming to an end here. And Rafi, I wanted to ask you to share with the watchers and listeners where they can find you, where they can follow you, just so we don't miss that as we close off the show?
Yeah, sure. So the easiest website would be RafiSalazar.com. So RafiSalazar.com. And that has links to the show, the Better Outcomes show. It has links to RehabU, the consulting firm, and has links to all of that. So RafiSalazar.com.
Okay, great. And from my end, I wanted to mention that again, you've got a good YouTube channel to follow. You've got a good LinkedIn presence as well. This is, I believe, where we first connected
Yeah.
for some mutual connections of ours. So definitely check that out as well. I have a feeling I'm gonna say it and I'm gonna record it, not even gonna edit it out later. I have a feeling like we've got material for at least a couple episodes here in terms of follow-up conversations. I hope we'll get to do that at some point. For today, I learned a lot, and I think the watchers and listeners did too. A lot more to dig into in episodes of Scale and Practice Management, and further on in the future. For now, I want to thank you. And in terms, if in case everybody's hearing about us at Talkie here for the first time from this show, we're at talkie.ai. That's our URL, and you can find out more about our AI voice agents there and how they can, as I mentioned, pick up the phone, take some burden off of the medical front desk at your practice without sacrificing the human element. It really goes hand in hand. I need to probably work on this pitch a little bit to make it a little bit more appealing for future episodes. We'll get there. We'll get there. Uh, for now, I am just going to ask my final insurance question, Rafael. Rafi, is there anything else that you wanted to add as we close off the show? Any other final pieces of advice there?
Yeah, I think the biggest thing is just healthcare is a human experience, and that means that everything we do really needs to be focused on enhancing the human relationships involved in that in delivering care.
Yeah, yeah. Thank you for underlining that. I feel like that is one of the most important things that was said here today. So that'll be it. Thank you again very much, Rafi, for coming on the show. Thank you so much, watchers and listeners. I hope you'll stay with us longer, follow Scale and Practice Management, and follow Talkie and all of that good stuff. You can also find me on LinkedIn, Jakub. I will be primarily posting about the show from here on out for the foreseeable future, and you can stay in touch with what Talkie is doing as well. For now, that's it for today. Thanks everybody so much for tuning in, and I will see you in the next one. Bye bye.